when and where, how does it really get going? And the subtitle is How Adversity Gets Under the Skin, because that's really what we're looking at. The diabetes is in some ways a natural endpoint, if you will, to a complex web of adverse experiences, some of which happen before we're even born. So our model of diabetes then has not been wrong, but it has been too small. We've been thinking that it was only about the genes that we inherit and our lifestyle choices, diet and exercise. And because we haven't been able to affect genes very well, at least not yet, we've kind of been beating our patients over the head with the lifestyle choices issue. And it's not that that's not important, but as Dr. Phil would say, how's that been working for us? You know, not incredibly well in a lot of circumstances. So perhaps our model is a little bit too small. So it's now clear that these alone do not explain all of diabetes risk. And it's also becoming clear that the roots of diabetes overlap with the roots of other chronic problems in our communities, health problems like heart disease and depression, but also substance abuse, domestic violence, learning problems, and others. So as we're understanding where the roots of these things come from, we're finding a whole lot of overlap and helps us understand why we're seeing so much of what we see. So let me give you an example. This is a study that it takes so many years for these health risks to play themselves out, so to speak, in terms of people actually getting a disease downstream, that you have to look at older people in order to see sometimes how this has worked. So this study looked at children who were born in Helsinki between 1934 and 1944. So of course now they're 70 years of age and older. Of this cohort born during those years, 320 of them had a unique experience. They were evacuated abroad during World War II. There was a real concern, a real fear that the Nazis would cross the sea there and invade Finland. It did not end up happening, of course, but there was a real threat that might have occurred. And so to protect these children, their parents sent them away from their country, from their families, from all their support systems, as it turns out. And on average, they were just a little under 5 years of age at the time of the evacuation, and they were gone for about a little over 1.5 years. 60 years later, compared with children who were not evacuated, these are still children who went through the stress of World War II, but they did not get separated from their families in this manner. The folks who were evacuated 60 years later are twice as likely to have heart disease and hypertension, and almost 1.5 times as likely to have diabetes, and close to twice as likely to have depressive symptoms. And as the study says, it's the first to show that early life trauma predicts higher prevalence of heart disease and type 2 diabetes in late adulthood. Our smaller model of diabetes would not know how to explain this because they control for all the things like health habits and the other things in order to do that. So you can see the studies there that relate to this particular thing, but it gives us a hint that there's something much larger than just genes we inherit and diet and exercise choices explaining all of our risk for chronic disease. So for diabetes risk, it matters what happened to us as adults. Yes, our diet and exercise choices, of course, count, but we have to remember that many people have access only to food of poor nutritional quality, even if there's plenty of calories. And we need to remember that this is actually another stimulus to overeating. We talk about obesity as being overnutrition, but in fact, it is only over-caloried. Most people in the world who are obese actually are undernourished when it comes to almost everything other than fat, carbohydrates, and for some protein. But the micronutrients are often in very short supply. And when the food you eat doesn't have a lot of that in it, you have to eat more of it to get that. And that is, again, a stimulus to overeat again. And also stress and trauma to us that happens to us as adults matters. It also matters what happened to us as children, just as that study we just talked about from Finland demonstrates. And you're going to see a pattern here that not only does it matter what happened to us as children, it also matters what happened to us when we were in the womb. It also matters what happened to our parents and to our grandparents. There's now evidence clearly linking that as well. And you can see that the recurring theme here has to do with nutritional quality and with variations on stress and trauma. These are the two recurring themes that will come back over and over again as we talk that afternoon. So you don't have to believe me on this. This is from a wonderful report came out of Harvard just a couple of years ago, that adverse pre- and postnatal experiences can have a profound effect on the course of health and development over a lifetime. Biological events that occur during fetal and postnatal life predispose the child to an elevated risk of subsequent problems in physical and mental health. So we're talking about pre- and postnatal experiences. Long before we even have any memory of any of these things happening, what happens to us has effects that last. And this was just in JAMA a couple of months ago, that confronting the origins of disparities in physical and mental health early in life may produce greater effects than attempting to modify health-related behaviors or even improve access to health care in adulthood. And that's pretty profound to make that kind of a statement, that if we can just address these roots, these early origins of these disparities we see in physical and mental health, that's more important than modifying health-related behaviors, which is, of course, what we spend a lot of our time doing in our clinics. Not that it's not important, but that it is probably not as important as what happens in the early life. So one way of looking at chronic disease then, one framework might be that chronic disease is the product of multiple stressors and risk factors which accumulate over the lifetime, and they're in all those areas that are listed there. That stressors affect both the body's physiologic regulatory systems, as we'll talk about, and they affect our likelihood to have healthy behaviors or not. Different health trajectories, so to speak, are the product of, and this is important, not only the risk factors, as we'll talk about those, but it's easy to lose hope when we think only about the risk factors, but it's the product of risk and protective factors. Sometimes we can affect the risk factors, and we need to do that wherever we can, and we'll talk about some ways to do that. But even if we can't change poverty, or we can't change some of the things happening in the homes of some children, we can increase the protective factors, and changing that ratio matters a lot. While stressors have effects throughout life, the body is especially vulnerable to them during critical developmental periods, which by the end of this, I hope you will believe, the prenatal and early lifetimes are. Or after all those heady kind of things, that I like this quotation because it actually sums it up just as well in some ways. What you walk around with are the first 2 to 5 years of your life. What gets imprinted, embedded, whatever term you like, in those early years lasts. So when we're going to look here at the brain for a moment, the developing brain is a remarkably shapeable and adaptable organ. And the brain's exquisite sensitivity to experience in early childhood allows traumatic experiences during infancy and childhood to impact all future emotional, behavioral, cognitive, social, and physiologic functioning. That's pretty amazing when you think that, again, we don't have conscious memory of our time during infancy and early childhood, but yet something is happening that affects all of those areas for the rest of our lives. And in these early life risk factors combined, they take their toll on the brain, again, for the rest of our lives. All those areas that you see there are things that we know are often hard in communities of poverty and color because of all the issues of racism and other problems that have happened. And as you look at that list, the more things you have on that list and the worse they are, you can see that by the quotation at the bottom that these are associated with lower IQ scores as early as age 2 to 4, and more behavior problems by age 3. Again, what happens early has lasting effects on our abilities for the rest of our lives. So let's take a look then at how this might be happening. Sorry, this is a little bit crooked. I'm not the best scanner in the world. But just to orient you, to the left is conception, so the first few segments there are, of course, our in utero period, and you can see we're actually not going to talk in this slide about the in utero period. It's going to be early life. Then you see our first year in months, and then starts to go to years and then decades, all the way out to our final demise on the far right. And what these curves are showing are two important things. One is experience-dependent synapse formation, as you can see there. And what that is, as you know, brain cells talk to each other across synapses. And we think that the brain is, when we're born, somehow complete, but only gets bigger or something. And in fact, that's not true at all. A whole lot of brain development happens after we are born. And in this critical area of what pathways are developed through the brain, if you are lucky enough to be born into a family with good, appropriate adults you can bond and attach to, with things you can play with. They don't have to be fancy toys, but something that helps promote your gross and fine motor development. All those kinds of things happen in a good way. You will develop these wonderful, complex webs of neural pathways that will serve you for the rest of your life. As the neuroscientists say, what fires together, wires together. If you are not so fortunate to be born into such a household, and you're born into one where the TV is your babysitter and there's no good, appropriate adults to bond and attach to, the brain will actually prune the pathways that are not used, let alone not create the new good ones that you would like to have in place. The other thing these curves are looking at is, as you can see, neurogenesis in the hippocampus. That simply means a new brain cells in the part of the brain that helps us to learn and remember. Without a good hippocampus, we don't learn or remember anything. So you can see where these two things would be critical for us for the rest of our lives. So let's look at the first of these curves, which is that dotted curve, and you can see that it peaks around age 3 months or so. And we see this clinically. One example would be all of us who do newborn care know that part of the newborn exam is to take an ophthalmoscope and look in the baby's eyes. One of the things we're looking for is congenital cataracts. And not that it's a common thing, but you want to find them if they're there, because if you do not find them and treat them, get them fixed before the child's first birthday, you may later be able to make the eyes see, but you may not ever be able to make the brain see, because you can see that this window has pretty well closed by not long after the first birthday. The second curve looks at the parts of our brain that help us to understand and produce language. And you can see that that peaks around age 8 months or so. And this is important in so many ways. You might think, well, 8-month-olds don't have the peak of their language development. You know, they're not spouting Shakespeare at age 8 months. But the pathways that will later allow them to do so, or to learn their own native language or a second language, or just simply to be very verbal and functional in this world, those pathways are being laid down at their peak around age 8 to 9 months of age. And so you can see where parents that are reading to their children, talking to their children, this would be very important. One of the differences between rich kids and poor kids is that rich kids hear 3 times the volume of words that poor children hear. And those words tend to be illustrative and descriptive and conversational, creating those nice, rich, complex brain patterns. Whereas poor kids not only hear fewer words, but the words they hear tend to be more negative and critical and all the other things that do not contribute to good brain pathways. So the third curve then is this big, long, dark curve, which is, of course, what we call our higher cognitive functions, part that helps us decide and think and process information. And you can see that that peaks around age 2 or so. So this is long before the schools even get at our kids. By the time they go to school, between age 5 and 6 there, you can see it's already starting to be on the downward slope. Still a lot happening. Still lots that happen in those early years of school. But you can see that actually the peak happens in the preschool period. We used to think that IQ was something that was genetically determined completely based on whether your parents were smart, depending on how smart you were. But as we saw in that last slide, things that happen in the child's life can have huge impacts on IQ. And in fact, IQ becomes fixed by about age 10. Another example of this is if you learn a second language before about age 10, you will speak it without an accent. But if you learn it after that time, you can see how far down that curve you already are by age 10. If you learn it afterward, you will speak it with an accent, just like my high school French. This next slide are things that, of course, are good for the developing brain and bad for it, both pre- and postnatally. And we talked about how important micronutrients are, not just enough calories, but enough of the micronutrients. Sensory stimulation, activity, and social interaction we just talked about on that last slide. You can also see the things that are bad for the brain. Of course, if mom is drinking or drugging or smoking during pregnancy, you know that's bad for development. We know that if mom smokes during pregnancy, for example, that increases the child's risk to get diabetes later in life, which seems like, why would that be? But we'll kind of talk about why that is. And you can see down that list it includes chronic stress for the child and for mom during pregnancy. So let's look at an example of what's going on with childhood obesity. Obviously, childhood obesity is a big risk factor for adult obesity. And this was a study done trying to understand what was going on with that. So they took a bunch of 3-year-old children, and they measured everything they could think about in terms of their lives, as well as, their height and waist circumference and all the rest of it. Then they waited 4 years until they turned 7. And at age 7, they looked to see which of these children had become obese. And they then looked back at all that data they had on them from when they were 3 years of age to see what would have predicted who was obese at age 7. And as it says next to number 6, it was not the number of calories that these children were consuming, or if it was junk food, or even if they'd been breastfed. What mattered was, especially number 2 and number 3, what the child's birth weight had been, and this weight gain in the first year of life, which sometimes gets called catch-up growth, sometimes called adiposity rebound in the literature, but it means that children who were born small for gestational age or even normal do a very quick catch-up to not only to average weight, but they just keep right on going, right on up into the overweight and then obese categories very often. So some people might look at that information and think that we need to put infants on diets, but that would be a mistake to think that that's what this is about. What this is about is a reaction. A reaction to what? Something that didn't go right in pregnancy, as we will talk about. So the next little sections of the talk are going to divide it up here by what the International Diabetes Federation said are the causes of type 2 diabetes. The first and the third are the ones that have been parts of what we've thought of as the model for diabetes, the genes we inherit and the lifestyle choices we make. We're also going to talk about some other things that kind of expand the model, especially on genetics, but also this fetal origins business, why that makes a difference in risk for diabetes later. And even though we'll talk about stress in relation to those first three, we won't actually have a lot of time for discussing that directly.